professeure WEN Yumei, qu'elle est académicienne chinoise et elle est très connue microbiologiste en Chine. Et aussi, elle travaille beaucoup sur le VHB et aussi vaccin thérapeutique de VHB. 下面我很荣幸介绍文一梅院士。文老师呢是复旦大学医学院分子病毒史的创立人。
Donc c'est la fondatrice de la discipline de Chine et surtout dans la recherche sur l'hépatite B et elle a réalisé des travaux très intéressants. Vous savez tous que l'hépatite B, le vaccin est déjà entré dans le 3e essai clinique. Et moi, j'ai une culte vis-à-vis de mon professeur. Je vénère inconditionnellement. Donc, elle parle très bien anglais. Donc, et aujourd'hui, nous avons grand honneur d'inviter mon professeur pour faire cet exposé sous vos applaudissements.
Comment allez-vous? That's all I know in French. Sorry. So I have to give my presentation in English. Today, I'm not going to talk about hepatitis B because currently I'm more interested to solve some problems in the aging world. So my topic is to follow my previous speaker on vaccine. Aging is a global concern, and vaccinology is to link science with technology. The aims of vaccine is to decrease burden, to promote economic growth, and vaccines will provide a healthier aging community. That is why we are interested to develop or to study the vaccinology in the adults. The current situation, the aging of the world, is a global problem. The prediction is that to 2050, there will be 2 billion people above the age of 60. And so that will be the 22% of the global population. And we can also see the growth of aging in China. In the other side, you can see that one is above the age of 60, and the other curve is above the age of 85. What are the diseases of elderlies in China? According to the statistics from National Health and Family Planning Commission of our country, there are nearly 50% of elderly patients suffering from various diseases. And one is the persistent infections and chronic diseases, including COPD and also tuberculosis, as well as other infections such as HBV, HCV, CMV, and HIV. And hypertension, stroke, and coronary heart disease come the next. And diabetes has become very prevalent in China, and Alzheimer's disease for the elderly, and cancer. We know that due to aging, the immune response of the aging population decreases. The immune senescence, what are the causes and associated factors involved, is lifelong antigenic stress. When we get older, we have antigenic stress or accumulated in the body of the elderly. And also the reduction of naive T cells. And also importantly, because of mitochondrial damage causing tissue dysfunction, and also metabolic malfunction and autoimmune diseases. So because of the aging of the immune systems in the elderly population, they will be decreased or upregulated of some immune responses. Here, the diagram shows that immunosenescence is the center. And because of that, due to the thymus decrease or involution of their function, and the telomere, which is at the end of the chromosome, shortening, as well as oxidative stress. Immunosenescence will lead to chronic infectious autoimmune diseases and decreased T cell function, as well as hormonal changes. So that will lead to different diseases: atherosclerosis, type 2 diabetes, osteoporosis, and dementia. So these are due to the decrease in the immune system. And usually when we give injections to a person, not a patient, a person, then you can see, first it goes to the subcutaneous region. And the lymph node is the center which will generate immune response. However, because due to there are other cells, not the naive T cells in the bone marrow, then the naive T cells, and also in the thymus, the T cells, as well in the spleen, the B cells, they all decrease. So usually, the vaccination for the elderly is not very successful. So what are the current preventive vaccines for the elderly used in China? Currently, there are 3 vaccines being used. One is the influenza vaccine. However, this influenza vaccine is similar to that given to children or to adults. And pneumonia, that is the 7 or more of 14 combined bacterial vaccine, and that is also provided for the elderly in China, whereas in Shanghai it's free of charge. And also VZV, that is for varicella zoster. But to be honest, the elderly do not like to take these vaccines. Very few of them would go to take the vaccines. So vaccinology, the aims and targets is most efficient to prevent infectious diseases. And because of the severity and incidence of infections, inflammation and chronic diseases increase with age. So the elderly is a particularly important target population for vaccination. And most vaccines are less immunogenic, and therefore they are less efficient in the elderly population. So what can we do to develop vaccines for the aging population? One, we think, is to have detailed study on the mechanisms of immune senescence in different groups of the aging population. Some are healthy elderly, some are with fragility, some have various chronic diseases. We think that epidemiology study of these different populations in the aging population, what's their reaction to the immune response? And we need to have systemic, epidemiological studies of responses to the current vaccines. For instance, for those we are establishing to study the response of the aging population to who took the influenza vaccine and see whether they have a rise in the antibody titer or they have no change in the antibody titer. We have to have a survey, a big systemic seroepidemiological study. And also we have to develop novel approaches for vaccines. We call it geriatric vaccines. And also we need to really study the novel delivery methods of vaccines. So what are the technologies for developing vaccines for the elderly? One is try to amplify the immune responses. So sometimes they give high doses of antigen or use adjuvant. We can use different adjuvants. And also they are studying addition of immune factors, for instance, at IL-2, IL-7, or antigen-antibody complex, which is our baby. Because I think in the 60s, some people studied in mice that by influenza and antibody in mice, the elder mice can develop good antibody response. And also to use vectors, modified vaccinia ankara, and also to improve the routes of delivery. Sometimes it's by delivery in intradermal, use patches, that will be better, or intranasal or per oral. These all have to be studied. And also for therapeutic vaccines, this is active immunization to stimulate effective immune responses. And if we look at the biologics under clinical trial in China, you can see that the highest is chemicals, is the middle, chemicals. Biological products is low, the lowest. Even for the biologics, you can see that prophylactic vaccines is higher than that of therapeutic vaccines and some other biologics. For instance, some plasma-derived products or other things. So that are the biologics being under clinical trial in China these days. And therapeutic vaccines in China has been developing. For infections, now we have therapeutic vaccines for HIV, HBV. HCV is less developed since we have the drug, and also TB. And also therapeutic vaccines for malignancies, for instance, liver cancer, lung cancer, and others. And also some people are developing therapeutic vaccines for autoimmune diseases, for instance, SLE, and also for allergic diseases as asthma. And there are also people studying therapeutic vaccines or early diagnosed patients for Alzheimer's diseases. So we have promoted a combined actions for the aging world and put this as a suggestion to our country. And this has been adopted in some of the policies of the government. 1C, we call it COME, C-O-M-E. C is to change concepts and policies, to change from only waiting for diseases, for treatment of disease, and move forward to prevention. So that is to change the concept and policies in health medicine, health, or we call it health science or medical science, and preventive vaccine. And the other is O. O is operation. We have to close gaps between the researchers and the clinicians and the industries so that all go into the research and strategies for the old age, we must close the gap. And what is M? M means mobilization. You have to really educate people and to let people participate in that. For instance, they have to know the knowledge of getting old, decreasing immune response, and how to improve their health situation. So that is mobilization. And E is to promote economy, because there are new areas for economy in China. You can, for instance, the pharmaceutics and those doing biologics, and also some, we say, the IP, all these you can provide some equipment for the elderly, so they can serve themselves and not wait to only be served by others. So we call it COME, and we have provide this as advice for the government. So in summary, immune senescence is a major problem for the aging group, resulting in chronic inflammation, persistent infections, autoimmune diseases, metabolic diseases, and cancer. And new technologies to identify critical immunological changes in elderly to various vaccines will help to improve preventive and therapeutic vaccines. We have only just summarized what are the usual pathways of the immune senescence. However, for each vaccine, perhaps you have to have different approaches, and which is the critical one for that vaccine. And the aims of this vaccine should also reach 3 A's. We call it affordable. It should not be too expensive. Acceptable. Try to decrease the injections, just my previous speakers has presented. And also available. Sometimes you have vaccines, but it's not available. So we need to really develop vaccines for 3 A's. And vaccine should be integrated in the COME. That is what we are promoting, and we're trying to do the sero-epidemiological study, do some basic study, and then follow the clinical studies and the vaccines so we can get data, big data, on how to control or how to help the aging world with vaccine knowledge. So thank you for your attention.